This is Lauren, and she works for me, and she has got a couple of chemical peels from me already, and her skin has come a long way since we started with her. Tonight, I'm going to do a peel that has some vitamin A in it, and what the vitamin A does, that helps push underneath the skin, and it kills the bacteria that's underneath there. And it also has salicylic acid in it, which Joanna touched a little bit on. And what the salicylic does, it exfoliates the surface of that skin. So it also helps to penetrate the peel. And I will show you, after we have that peel on her, how it stays underneath the skin. And the great thing about most of the peels I do here, they pretty much self-neutralize. So you walk out of here with that peel on your skin. Nobody will see it. There's one peel I do, sometimes you'll see it, but otherwise, no. But they really work, guys. If you have any issues, oily skin, acne, hyperpigmentation, peels are the way to go. You know, they really do. They go below that epidermal level, which is where our bacteria is, and that's what we want. We want to attack that, get rid of it, flake it off, and you'll have great skin. So depending on how bad you have acne or oily skin, that depends on how many kind of chemical peels you might need. You know, and we can evaluate you on that, okay? So the first thing I'm going to do for her is I'm going to cleanse her skin really well. And we call it basically degreasing her. Because if she was very oily, the peel would have a hard time penetrating. So we're going to make sure she's really nice and degreased. So I'm going to start cleansing her now. And I'm just using a real gentle cleanser on her. And it's just like a makeup remover to get off any makeup she has. Sorry, it was cold.
Yeah, it's kind of cold.
Sorry, it was sitting there for a while. But Lauren is a really good model for this because, like I said, we've done how many? 2, Lauren? 2 chemical peels on you so far? And her skin has come a real long way with it. And she's also using some really good products, which really help also. And you all will walk out of here with products in hand, so get you kick-started. But the important thing with products is you have to use them, guys. They can't be sitting on your bathroom shelf. And guys, I always use a hot towel when I'm doing a peel because it helps to open up the pores and it also helps to penetrate the peel a little bit deeper. She will get some flakiness after it, probably in a day or 2. She'll have a little bit of flaky skin, not like a snake. I don't want to scare anybody, but you will have some flaky skin. You put some hydrating moisturizer on there, sunblock, and you're good to go. You're good to go. Okay, is that too hot, sweetheart, or is that okay? And again, all a hot towel does, it just helps open up the pores. And it feels kind of good. I've been in the skincare business about 11 years now. And I've always been on the medical side of it. I don't think I could do a regular facial for anything. I've always totally been clinical. I've always worked for plastic surgeons and cosmetic physicians. There's nothing like being able to help somebody that has a problem with their skin and watching that transformation. All right, guys, and I'm just going to take a little cool towel. Just make sure she's cleansed. Just on a plain old piece of gauze. That feels good after it. Yep, she's clean. Nothing on there. And guys, the reason why she's red A, I'm not gentle. I really try to get the skin up. And we want her to turn a little bit pink because that means her vascular level is great. And that's just gonna show me how quick she's gonna heal from a peel. So if somebody, an older person who doesn't kind of pink up real quick, that means they're gonna take longer to heal. So we know Lauren's gonna be a quick healer when it comes to skin peel.
I'm red, aren't I?
You're pink.
Oh, God.
That's from the hot towel though.
Oh, yeah.
But that's okay. Okay, guys, I'm just gonna dry her up. It was from our hot towel. Okay, Lauren. And guys, my last step with her, I just take a little alcohol wipe. Remember how I told you it was important to degrease her skin? That's what we're gonna do. We're gonna degrease her skin. We're gonna make sure there's no oil on her at all. And like I said, the peel I'm using is just some salicylic and some vitamin A. And it doesn't take a whole bunch. That little bit is enough to cover a whole entire face. Okay, and I always work from the back of a glove. And then I just dot it on her. So just make sure I cover pretty much her forehead, her cheeks, her chin. And then I make sure I work it in. Pressure is important. We want to make sure it's enough pressure where it's going to get underneath that skin. We want it to hit its target. So what I'm doing now, I'm just massaging it in, and when it starts getting thicker on her skin, I'll just start to push it underneath there. And you'll be able to hear that by my glove. Across the lip. How you doing, okay? Mm-hmm. And Lauren, what would you say your comfort level is on a scale of 1 to 5, 5 being burning, 1 being barely anything?
0.
Good. Okay, guys, you can see my hands are not so slick anymore, so we know her skin's getting tight from the peel. So now I'm just going to start pressing it in. And the longer we press, the deeper it's going to go. Doing okay?
Mm-hmm.
Okay.
This actually feels like really, really good. It doesn't like hurt or do anything, so it's not like...
The last peel you had, Lauren, did you peel a lot from it?
I didn't peel at all.
Good. Now see, guys, how you can't see that yellow. Remember how bright it was on my glove? Remember how bright it was when we put it on there? You can't see it on her skin anymore, but I'm going to show you something that truly is amazing. When people when they don't quite believe in skincare and, you know, it really doesn't do anything, I'm going to show you exactly what it does. And, yep, Carol, please, that one too. We went total darkness. But oh, I'm sorry. But see her skin, guys? Look how she glows yellow. Can everybody see that? And you can't see it on the surface of her skin at all. And what I do, see it's just like a little spot there that we didn't get. Just take your finger and I just put more peel on there. You can even see it on my glove. But that's how the peel penetrates underneath the skin. So no one even knows it's on top. Can everybody see that? We're good? But guys, that truly is how quick. That took me, what, 10 minutes? Not even, to put a chemical peel on her face. It's going to stay on her skin. She can sleep in it if she really wanted to. Like I said, it self-neutralizes. So it only will go so far. It'll reach its target and stop. And she can wash her skin in the morning. But right now, she is good to go home and go to bed. As long as she doesn't put any makeup on top of her skin, she's good. Now, if we were doing this during the daytime, I'd put a sunblock on top of her, because we don't want her to walk out of here without any sunblock if that sun is out. Or even if it was raining, any kind of daylight, I would have put a sunblock on top of her.
How do you feel now, Lauren?
I feel good. I feel relieved because I know that in a couple weeks my face is going to be a lot better than it is now.
Yeah.
So.
Was it like a therapeutic experience?
It really wasn't
relaxing?
actually bad at all. It actually felt really good.
Good.
So, like, it doesn't sting, it doesn't hurt, it doesn't burn, like other things, like other medicines that they like would put on your face. Like, it's not like that.
And you can see she's really not that red. She's a little bit of pinkness to her, but really not red. The redness is basically from the hot towels that I used on her and from all the rubbing, but it really isn't from the peel. But it's just from the stimulation of her skin. Okay. All right.
Cool.
Thank you, Miss Lauren. I appreciate it.